Hi everyone, welcome to POC Nurse. My name is Gozi. In today's video, we're going to talk about must-have technology for home health nursing. So in case some of you are new to home health nursing is when you as a nurse goes to a patient house to provide nursing care. Sometimes the nursing care you provide in the home could be the same as what you would provide to the patient at the bedside in a hospital. For example, you could go into the patient's home and you would do wound care. Sometimes you could go into the home and you have to change a Foley, things of that nature. So you're going to go do that, leave that patient and go to your next patient. So this is not a case where you go to a patient's house and you care for that patient all day. The kind of home health nursing we're talking about today is when you go from patient to patient, as in house to house, providing nursing care. So today we're talking about must-have technology for this kind of home health nursing. So I did home health nursing for a couple of months, and the things I'm going to talk to you about are the things that I used and the things that helped me. So the first thing you're going to need, obviously, is your blood pressure cuff, your stethoscope, your O2 sat monitor, your thermometer, a scale for checking the patient's weight, and a tape measure. So one thing I'll say real quick is that the agency I worked for, they gave me a blood pressure cuff, they gave me those disposable stethoscopes, they gave me a little O2 sat machine, they gave me a thermometer, tape measure, but no scale. The tape measure they gave us are the disposable paper tapes, and we used to leave them in the patient's house. But I still carried a bunch with me in case the one they had was not available. And the ones I carried with me were also paper tape that were disposable. It was about, I think it was over 6 feet long. It was very long. I needed them to measure the patient's ankles, especially the heart failure patients, to see if there was any increase in the circumference of their ankles. So I didn't need a 6 feet long tape measure to do that. So I would often cut it down to 1 foot, like 12 inches, to use it, and then I'll leave that in the patient's house with the rest of the cutoff tape. I'll cut it in two and leave those two pieces in the patient's house. Another thing is that even though the agency gave me an O2 sat monitor, a little one, I got another little one. But the one that I got will give me the O2 sat, the pulse, and respiratory rate. The one that the agency gave me only gave me the O2 sat and respiratory rate. So I really liked the one that I got, and it worked well. Sometimes the one from the agency wouldn't work, and I found that luckily sometimes the patient will have an O2 sat monitor, and then I'll use theirs and it would work right away. So it happened to me a couple of times, and then I decided to buy mine because the ones the patients had, they were buying off of Amazon. So I went on Amazon and I bought an O2 sat monitor for myself. Another thing you might want to do is get yourself a very good stethoscope. So I have a good stethoscope. At one point in my life, it was the most expensive thing that I owned. I paid almost $300 for that stethoscope when I started working in the ER so that I could hear the patient's lung sounds. I don't know where I put it because during COVID, I stopped taking it to work. I just felt weird taking it from patient to patient. You know, you take it into this patient, they have C. diff, you wipe it down with bleach stick. It just didn't feel right to me, so I stopped taking it to work, and I would use this disposable stethoscopes at work. I use one per patient, and when I finish, I throw everything in the garbage. I felt better that way. So it would be nice to have a very good stethoscope so that you can hear the patient's breath sounds when you listen, bowel sounds very clearly, heart sounds. You can use it to check your blood pressure, because in home health care, at least in the agency that I worked at, we did a manual blood pressure. So those are two things you might want to get on your own: a very good stethoscope and a good O2 sat machine that will not disappoint. Another thing you might want to get is a thermometer. They give us a thermometer, but they gave us the one you actually put on the forehead, a temporal thermometer, which I liked. But I also bought, I think it's called an infrared thermometer, the non-touch thermometer. I got that one also. And anytime the infrared was kind of weird off, I would use the temporal one where it actually touches the patient. Now, One thing that goes with all of this equipment is wipes to wipe them down after using it on one patient. So they gave us the purple top wipes at work, the big tub. It's kind of hard to carry in your bag, so what I did was, that purple wipe, you can buy the little packets of it on Amazon. So I bought the little packets and I put it in my bag, and that's what I brought with me, so that after every patient encounter, I would wipe down the equipment that I used on that patient, let it dry, and then be on to the next patient. So in doing this, there's a certain technique for taking things out of your bag, and before putting them back into your bag, you have to clean your hands in between. I think that would be a video for another day, but you need to wipe down everything, let it dry, and then put it back into your bag. So that's the first thing you need, obviously, along with a bag to put everything in. And the agency usually provides a bag, but you can buy your own bag. When I worked home health nursing, I used the bag the agency gave me, but I kept looking for a nicer bag, that would meet my specifications or needs, but I never found one yet. But I plan to go back to home health nursing as an agency nurse, because I feel like it's something I personally can do for a couple of months, but not like on an ongoing basis. If I know that I have an end date to working a home health job, I think I'll feel happier. So that's what I'm gonna do. But I digress. Now, the next thing you're going to need as technology for your home health care job is a device. Now, when I say device, it could be a tablet or it could be a computer. I've seen some home health nurses carrying computers. I carried a tablet. I would have loved to have a computer, because I wear glasses, and I find I have to wear it more often. But most especially after staring at that tablet for long hours, my vision starts to get blurry, and I have to go put on my glasses. So I feel like if I had a computer, maybe it would be better. I don't know, but I carried a tablet. Now, why do you need that tablet? What is it going to do for you? First of all, you can access your patient's medical records on the tablet, but you have to have someone at your agency show you how, because no one showed me how to access the patient's actual medical records on my tablet until one day I was asking for paperwork, so that when I go to a patient, I kind of have their history. I know, their past medical history, why they were in the hospital, if they were in the hospital, or why we're going to see this patient, just stuff about the patient, like I can go and read up on the patient. I was asking someone for actual paperwork of medical records, and they showed me how to access the patient's medical records, on my tablet. So that tablet will give you access to your patient's medical records. That way you can kind of tailor the care you're going to provide to the patient by knowing what's the most pressing need of the patient right now. Patient might have diabetes, patient might have heart failure. If their diabetes is well controlled and they just got discharged from the hospital for heart failure or COPD, then you would focus your care and teaching on the disease process that took them to the hospital and that they're recovering from, so that they can do all the right things to hopefully prevent them from going back to the hospital. And you can also prepare your education ahead of time when you have access to their medical records. And we'll talk about an app for education later on in this video. Alright, so the device, whether it be a laptop or a tablet, should give you access to the patient's medical records. The next thing you can do on your device is chart on your patient. So when I worked in home health care, I had a device, and on that device I charted everything on the patient. And there is I don't want to say form, but when you open your device and you go to do your assessment, do your vital signs, the tablet will give you all the questions that you need to ask the patient. So you just go through the questions one by one and chart as the patient answers. And then when you do your vital signs, there's another place where it should go in the device. So you do your vital signs and then you input it on your device. So all your charting is going to be done on your device. Now, if you also need to write a note, you're also going to do it on the device, and everything gets pushed into the patient's medical records. Now, your device should also give you access to communication. What do I mean? Either it can give you access to communicate with people at the job, send them emails. So more specifically, email. So I used to have to take pictures of consents and then email it to the secretary at the office, because there were no copies of the consent that I could leave with the patient. So I'd have the patient sign everything, explain everything to the patient. Then I'll take pictures, send it to the secretary at the office to attach to the patient's chart, and then leave the original copies with the patient, because there is no carbon copy for me to leave with the patient. Also, you can email people at work right there on the spot from your device, and hopefully they see it and answer if you need an answer right away. If you don't need an answer right away and you just need to report something, you can write it there and then send it to whoever you need to send it to. Now, I used, like I said, my tablet and the email for sending patient paperwork. The tablet should be secure, it should be HIPAA compliant, therefore there should be no problems with you doing that. I had no problems at my job. I'll take the pictures of my consent paperwork and send to the secretary, and that was fine. Now, the next thing I used my tablet for was interpreting services. So, it was funny. First, I was using it just for language, but I found that when I used it for language, I couldn't chart. I should have been able to chart, but for some reason, when I was using it as a phone to talk to the patient, let's say I was using it for Arabic or Spanish, I found that I couldn't chart, which sucked, because I wanted to talk to the patient and chart while I was, talking to the patient. And I didn't like the whole time just focus on talk chart, but I did want to get some charting done. So when I noticed that it wasn't working, I was like, okay, I need to do something about it. I'll tell you what I did in a little bit. So now I could use my tablet for actual languages that you speak with your lips. I could also use it for sign language. Now, when I use it for sign language, obviously someone has to be on my tablet, and the person I'm talking to has to see my tablet. So when I used it for sign language interpreting, I couldn't use the tablet at all. So that means I couldn't chart anything. But you still have to ask your questions of the patient. So what I did was I had like a nurse brain, like a paper, where I would write all the questions and the patient's answers so that I could input it into the tablet in the appropriate spot later after I leave the patient. Because obviously if I'm using the tablet as a video communication device, I can't type anything on it, I can't work on it. So you would need an app on your tablet for communicating with patients, be it sign language or various world languages, international languages. And the next thing I was going to jump in was that nurse brain or paper to take down information that you can put into your tablet or device at a later time if you cannot chart while you are with the patient. So it could just be a blank piece of paper if you know all the questions you need to ask already. If you don't know the questions you need to ask, you can make yourself a nurse brain. Write down everything that you need to ask the patient as much as you can remember, or go through all the questions, especially if you know you're going to need to use your tablet for sign language beforehand, which you will know, because usually when an admission is done, patient's preferred form of communication via language is in the chart. So if you know ahead of time, you can make up your nurse brain, look in the tablet, write down what you need to ask, so that when you get there, your workflow can be smooth. You can call the patient, ask all your questions, write down all your answers, do your vitals, write them down, and then when you leave, you can input them into the computer and then be on to your next patient. Now, another thing needed is on your device is a GPS. So the GPS on my tablet was really nice, and hopefully all home health agencies out there have it. So I had a function on my tablet where my tablet would map out all of my patients on a map, right? So if I had 5 patients in 5 different cities, the tablet will map each patient in the city that they're in. And when I look at them, and the map also maps the office, and wherever you are, it will map your distance from where you are to the office and all of your patients. So then I could see how I could figure out who to see first, second, third, fourth, fifth, sixth, and so on, or how I could break up my visits so that I could see everybody in good time. So the GPS function on your tablet is something that could help streamline your workflow extremely well. The other thing that the GPS can do is give you actual directions of how to get to your patient's home from where you are. Although I use my phone for GPS because I'm used to the GPS on my phone, but you can use the GPS that's on your tablet to get from point A to the next patient, to the next patient, and the next patient. I never used the tablet that was I never used the GPS that was on my tablet, also because I'd have to buy a stand for the tablet and put in my car, and I didn't want to do that. So, but the GPS does, the device, your tablet or laptop computer should have a GPS so that you can see where your patients are on a map and then plan how you're going to see your patients for the day. The next thing that the GPS does is help you track mileage. You do get paid for mileage in most home health agencies, so it's money. You're paying for gas, you're putting mileage on your car. It's not a lot of money, like 50 to 65 cents per mile, but it's money, and you need to keep track of your miles so that you can get paid for it. And the GPS app on your device can help you do that. Next thing I did, just me, is I got Google Voice. It's an app that you can use to make phone calls. When you use that app, your phone number, your real phone number will not show. Instead, it will show the phone number that Google Voice gives to you. A lot of people know about Google Voice. I've been using it for a long time. A lot of the teachers at my kids' school use it so that they don't give me their direct number. They give me their Google Voice number, and then we can text back and forth that way, and also make phone calls that way. So I use Google Voice personally, but I also have an extra phone that I use for my home health nursing. So the thing is, when you start doing home health nursing, and let's say you have 6 patients one day, sometimes 2 of the patients will keep calling the office wanting to know when you're going to come see them, or that you're not there yet, where are you? And usually the office will give them your phone number. So now you have the patient calling you on your personal phone during work hours. That may be okay. But during your off hours, they could also still keep calling you on your personal phone. So what I did was, I had that extra phone, and I would give that number to the patients all willy-nilly. I'd give it to the doctor's offices that I called, so that when I feel like I was done for the day and calls kept coming through that phone, I didn't pick up unless it's a certain kind of patient that I'm worried about. Then I'd pick up the call. If not, I didn't pick up the call, or I'll text and say to the person. Also, I usually would ask the patients to text me. So if the patient is calling me and I have a history of texting back and forth with the patient, I'll tell the patient, whatever it is, I'm sorry I missed your call. If you need help or assistance, please call the office. I'll say something like, I'm off. I wouldn't even say I'm off. I'd just say, I'm sorry I missed your call. If you need anything, please call the office. The office is open 24/7. Whatever you need, they'll help you with it. So that's what I would usually do. So you could do this. You could carry an extra phone. Ask the office to give that phone number to patients if they call asking for you. You could give that number to your patients. Sometimes you call doctors' offices and they'll ask for a number to reach you back at. You can give them that number. If you don't want to have an extra phone, which of course will cost you extra money, first you have to buy the phone and you have to pay the monthly fee for the service. what you can do is get Google Voice. With Google Voice, you can make calls to patients on your own personal phone, but when you call them, the Google Voice phone number will show up on their phone. They can also call that number and it will ring to your personal phone. Now you can choose to answer the call or let it go to voicemail, see what the patient needs, see what the doctor's office is calling you about, and then give them a call back. Another way that extra phone assisted me was that remember when I told you that anytime I was using the language line, it was difficult for me to chart. So I had that problem with just the voice part of it. Like I would call for Spanish, Arabic, Polish, whatever language you can think of. And while I was talking with the patient, I couldn't chart for some reason. The EMR portion was freezing up. I couldn't chart anything. So what I did was I would call the language line from my extra phone and then ask the patient all the questions and chart on my tablet. So that's another way that the extra phone served me. He helped me streamline my workflow and get things done smoother. I would say, I don't like to say faster, but it helped me get things done smoother. Now, I feel like the last and final thing you would need is an education app on your phone so that you can use that to teach the patient about whatever it is you want to teach the patient. On the flip side, if you don't want to use an app, you can carry actual literature with you. It's a lot of paperwork to carry around in your car, but I do like carrying the literature. I like giving it to the patient and going over it with the patient. But if you don't want to do that, you should have an education app on your device provided by your home health care agency. We had one, I think it was Creams. It was Creams, but there's also Elsevier, and I'm sure there's others out there. So you could use the education app for your teaching. You could bring literature with you from the office and use both together. Use the education app and leave the literature with the patient for them to go through later. Hopefully to be in the language that they speak so that it will actually be helpful. I think these are all the kind of technology things that a home health nurse would need for today. In the future, I'm sure there'll be more things that we could use in home health nursing. Something that could monitor the patient's vital signs from afar, like remotely. Probably something that could help you make decisions while you're with your patient. But for today, for now, these are the things that I feel would help while you're doing your home health care services or care. You know, the blood pressure cuff, your Otosat monitor, your thermometer, your tape measure, and your scale for the patient's weight. You need your device to access the patient's medical records, to chart, to send communications to other people in the agency or at the office, such as emailing them patient consents. It also gives you access to an interpreter. Well, it should give you access to an interpreter so you can see patients that do not speak English, that speak other languages that's not English. You need a nurse brain or paper and a pen to take down information when you can input it into your device right away. You'll need a GPS that can hopefully help you map out where all your patients are on an actual map so that you can decide on what your workflow for the day will be, which patients you will see first, second, third, fourth, fifth, and so on. You'll also need a phone for patients to reach you at, for doctors to reach you at, and for your office to reach you at. But the most crucial part is the patient and the doctor. Because, of course, you can give your phone number to the office. They know not to call you after hours. But the patients don't. The doctor's offices don't. Depending on how serious the issue at hand is, the doctor might call you back. I've had a doctor's office call me back at almost 7 p.m. in the evening to give consent for a start of care. It was okay. I took the call. It was a very brief call. So it's nice to have another line that you know for sure you can ignore and go about your day when you are off the clock. So you can either get an extra phone or you can get an app like Google Voice. I'm sure there are other apps out there, but I use Google Voice. It works very well. Most of all, it is free. And the last thing I think you would benefit from is having an education app or educational literature that you can share with your patient after or while you're going over their disease processes and providing education to them. That's all I can think of for now. These are the things that I actually used. If you have any questions for me, put them in the comments. If you have any other tips on technology in home health care that can help the home health nurse, put it down in the comments also. Thank you for watching. Thank you for listening, and I'll see you in the next video. Bye bye now.